Well, this week, the American College of Obstetricians and Gynecologists released its updated vaccine schedule for pregnant women. It recommends women get the COVID-19, flu, RSV, and Tdap vaccines at different points in their pregnancies. This is the first time in history that a COG has released guidelines that differ from the federal government's, or CDC, I should probably say. We want to bring in 9 News health expert Dr. Payal Kohli. Dr. Kohli, why now?
So the ACOG, or the American College of Obstetricians and Gynecologists, was very clear on this. They said they want to fight mis and disinformation. They want to provide the government with reliable, evidence-based recommendations. And really, they're following the precedent of other organizations like the American Academy of Pediatrics, which back in the fall actually updated their vaccine schedule, which is also in conflict with what the CDC has said. So it really is creating a stir in the medical community. Because
unprecedented.
Unprecedented, yeah. Sam. And it really does raise the question of now who should we follow as physicians, because we have our professional organizations here, we have the government here, and also what the insurance companies are going to do. Are they going to follow the CDC guidelines? Are they going to go with some of the other professional organizations?
And not just the physicians, but all of us. This is confusing, and politics play into it because you have an administration and groups that are kind of butting heads. We're not taking a political stance here. We're just telling people what's happening, and these recommendations are now controversial because they differ from what the CDC recommends.
It does, Phil. And I think the most important thing here is to talk about the science. So let's review the science. So the biggest difference is the COVID-19 vaccine. So the CDC also does recommend the Tdap, does recommend maternal RSV, but ACOG is saying very clearly that women need to get the COVID-19 vaccine. They also recommend the flu vaccine as well. And that's not just good for mom, it's good for the baby, it's good for both parties. So let's talk about this. When a baby is born, their immune system is completely naive, right? So they're not often able to even mount an antibody response to vaccines. And sometimes they can't even get the vaccine. So giving it to mom while she's pregnant means that her immune system can make those antibodies and pass them through the placenta to the newborn baby and offer protection essentially right away. But it also protects mom because when she gets the shot during pregnancy, which we know compromises her immune system, it can prevent more postpartum complications as well.
Oh, this is vital, and for so many different reasons. And you mentioned some of the medical groups. I just want to hear you list some of them that are also reacting to this.
So the top 2 that have really thrown their support behind the ACOG is the American Academy of Pediatrics, which is saying that this is what they recommend as well as the American Academy of Family Practitioners. So that's the AAFP, that's the primary care sort of medical group. And there's 13 of them, in fact, who have supported the ACOG recommendations. But, going back to what I said before, is that really this is starting a precedent where you're starting to see more and more divergence between the government and these professional societies. And in fact, there was a lawsuit filed to overturn the CDC recommendations that the American Academy of Pediatrics filed. And there is a stay right now on whether or not the CDC recommendations can continue to persist in the face of that lawsuit. And then RFK Jr. fired back with, well, they're in the pocket of the drug companies, and that's the reason they're recommending this, which I don't believe is what the science is showing.
So, okay, having said all of that, what are pregnant women supposed to do? And I would imagine it comes down to what you usually tell us is, consult with your doctor.
Talk to your doctor. I mean, I hate to say it, but it really does end up being every pregnant woman for herself and for a pregnant woman to understand her own risk, because some of these recommendations do also matter about the age of your pregnancy, your family history, your medical history, any complications you're having during pregnancy. It is a very personalized decision, but I want every single pregnant woman to ask that question of her obstetrician, her gynecologist. And it's not just the pregnant women. We're also talking about the postpartum period, the breastfeeding women. We're also talking about anyone who's thinking of getting pregnant, because there's some vaccines that you cannot get during pregnancy, like the measles, mumps, rubella, the varicella vaccine, any other type of live vaccine. So it's really a process where you need to take this into your own hands, sit down and talk to your doctor and make sure they're making the right decision for you. And try not to read too many things online, because when you read 10 different things, you might get 10 different answers. I mean, even the professionals are disagreeing.
All right, Dr. Kohli, great information. Thank you.